Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Allergy awareness has been very prevalent in the pediatric population, especially in the elementary school setting. But there is still some confusion between food allergy and food intolerance. I'd like to clear up some of the misconceptions today between food intolerance and food allergy, and also how food allergy relates to eczema, rashes, eruptions, and even asthma. On this next episode of Ask the Doc, No Appointment Needed. Hi, I'm Dr. Scarlet Constant, founder of Constant Care Pediatrics. On this episode, welcome to Ask the Doc, No Appointment Needed. This is where we encourage you to send in your questions so that I can answer in real time. And on this episode, we are going to discuss everything allergy, eczema, rash, and more. It looks like we have a question coming in now from YouTube. This is from Dion. Hello, Dr. Constant. What are some symptoms of food allergies in children? And which ones require immediate treatment? And what can you tell me about EpiPens? Okay, Dion, well, there are a lot of questions there. First, let's talk about the symptoms of a food allergy in a child. Food allergies usually present with either an eruption on the skin called hives or urticaria. So we know them as hives. These are raised lesions that come up on the skin. They're very itchy, and it happens within the first 2 minutes of food exposure. Hives do resolve with medical treatment, but that should alert you right away that your child is experiencing an allergic reaction. And the next symptom that we could also have is either itching in the mouth, swelling of the tongue, swelling of the lips, or even vomiting. A lot of people really don't associate vomiting with an allergic reaction, but that is basically what we call an IgE-mediated response, which is happening. You have inflammation throughout the body. So the inflammation and the histamine release that happens in the skin cells will show up as hives. The histamine response that happens within the oral mucosa in your mouth or tongue shows up as swelling of the tongue and lips. But when that happens in the GI system, it manifests as vomiting. So those are some symptoms that will alert you that your child is actually having an allergic reaction. The next part of your question, if I remember correctly, was which ones require immediate treatment. Any allergic symptom requires immediate treatment. If your child has been exposed to food or an allergen and they are demonstrating any of those symptoms whatsoever, which signifies an allergic reaction, what we call an IgE-mediated response, then you have to act immediately. Now, your response will depend on the actual allergic trigger and your child's allergic status. So it could be something as minimal as Benadryl or as severe as an EpiPen. An EpiPen is short for epinephrine pen, and this is an injection. It's an actual pen with a needle at the tip where you would be able to inject epinephrine into the body. And the reason why we do this is because, like I mentioned earlier, in an IgE-mediated response, you have an inflammatory reaction. So your blood vessels are dilating. You have fluids that are seeping out, causing all of this swelling and causing the fever and even vomiting if your intestines are swollen. Epinephrine is going to do the opposite. It's going to vasoconstrict, shrink everything down, stop the swelling, stop the reaction from happening, and bring you back to baseline. And that, again, the response depends on the allergic reaction, on your child, and what the trigger was. Thank you for your question. So here's another question coming in from the All Health TV app, and this question is from Lorraine. Dr. Constant, my daughter began having negative reactions a few months after being bottle-fed milk. She began vomiting and had blood in her stool. The doctor diagnosed her with a milk allergy. What's the difference between allergy to milk and milk intolerance? Well, Lorraine, that's a great question. So when there's an allergy to milk, it's actually a cow protein allergy. Your child has an allergy to the actual cow protein, and they will manifest this, or they will show these symptoms by sometimes vomiting, but most commonly in infants, you will see blood in the stool. And this will be a progression. Usually there are a couple of flecks of blood in the stool, and then over time you start to see more blood in the stool, and that signifies a cow milk protein allergy. And again, this is what we call an IgE mediated response. The IgE, which are our antibodies, are reacting to the milk protein, and that reaction is causing vasodilation and inflammation. An intolerance, on the other hand, is usually either lactose intolerance or maybe an intolerance to the whey casein. And this is when the baby or your child is not able to properly break down the proteins in the milk in order to digest properly. Lactose intolerance means that you are lacking the enzyme that will metabolize the lactose in the milk. And lactose intolerance is very, very rare in infants. It actually usually presents itself by 20 years of age or older. So something like less than 1% of the population has a lactose intolerance during infancy. It looks like we have a question. If you want to send in your questions, please make sure you go to All Health TV and submit your questions, or even on YouTube. Here's a question from Willow. Hi, Dr. Constant. My cousin has a pretty serious peanut allergy and always carries an EpiPen. We are vegans, and I haven't been giving my kids any nuts because I'm worried about that they might have a reaction too. Do food allergies run in families? Willow, yes, they do. Okay, Willow, so to answer your question, food allergies do run in families. You just have a higher risk if you have a close relative that has a food allergy, such as your mom or dad or sibling. I wouldn't necessarily say it runs in families across cousins and aunts and uncles. It is not hereditary. It just happens to, there happens to be a triad that's common within families. Now, about not giving your children nuts, if you are vegan, you actually are giving your children nuts every single day, as most vegan products are replaced with cashew. They use cashew butter, shortening. So there are actually a lot of different tree nuts used in vegan products, just so that you're aware. And I think it's important for people that are actually allergy aware and trying to be allergy aware to understand that most vegan products contain different types of nuts. That is not to be confused with peanuts and peanut allergy. A peanut is a legume. So if you are allergic to peanuts, you might not necessarily be allergic to tree nuts. And tree nuts include walnuts, pecans, cashews, pistachios, etc. So there should be a distinction made between the two, and for you to understand what products are found in vegan foods and what products are found in the other foods that you're serving your children. So it looks like a lot of people have questions about this. This is a hot topic: allergies, eczema, rash. We have a question coming in now from our All Health TV app from Sonia. Hey, Doc, does early exposure to different types of foods help prevent allergies? Sonia, yes, absolutely. We try in pediatrics, we try to encourage families to introduce your typical allergens between 4 and 6 months of age. And yes, the idea is hopefully you're able to introduce it in small doses to desensitize your child to these allergens. So the earlier, the better. Okay, we have another question coming in from Richie. Hey, Dr. C, our 3-year-old has been getting what seems like rashes lately. Is there a difference between a regular rash and eczema? And what exactly is eczema? Well, yes, Richie. So a rash is just a generic term for any type of skin lesion. There are many types of rashes of different varieties. So it depends on your child and whether or not your child is sick, has a virus, maybe they had an eruption when they were exposed to something. So that's completely different. But eczema itself is actually what we like to call allergy in the skin. Eczema is a condition where we have dry skin, and the barrier of the skin is actually disrupted due to a IgE antibodies. And so the bond is disrupted and they're unable to hydrate their skin. So we really try to treat eczema by hydrating the skin and restoring the bonds in the dermal layer in order to keep in that hydration and moisturize the skin and prevent further dehiscence or any type of trauma to the skin from the eczema. So eczema is part of an IgE-mediated response, and eczema is part of the allergic triad, which is eczema, allergies, and asthma. And you see this eruption. Eczema can be triggered by dry skin. It could also be triggered by introduction to an allergen. So it's not necessarily an allergic reaction, but it is a response when an allergen has been introduced. There's also a form of eczema called atopic dermatitis, where you actually are in contact, your skin touches something that not necessarily, that causes a type of allergic reaction. So it doesn't mean you're allergic to this product, but it does cause a reaction in the skin where you will have redness, inflammation, and disruption of the dermal bonds. Okay, so it looks like we have a question coming in from Carrie. Hi, doctor. Our adolescent kids seem to be predisposed to getting eczema and acne. We'd like to know how can we help them have a normal childhood, even though they have these skin conditions. So Carrie, so if you're predisposed to eczema, that usually just means that you have very dry skin and you tend to have flare-ups. So if your children do have eczematous flare-ups, I really encourage you to make sure they're taking care of their skin by washing every day with soap and water. Some people believe that the more showers they take, the more it dries out their skin and the worse the eczema is. That couldn't be less true. You actually want to take more showers and you want to hydrate the skin more in order to restore those skin cells and the dermal bonds. And then after you hydrate, you want to moisturize, usually using a moisturizer that has ceramides, because ceramides will then close up those broken bonds and help restore hydration in the skin. Now, if your child is predisposed to acne, let's say, then you want to have a regular skincare routine to prevent the acne from recurring. And that's going to include, of course, like I mentioned, hydrating the skin, moisturizing the skin, but also cleaning the skin, usually with like a benzoyl peroxide or maybe a salicylic acid, depending on the type of the skin type your child has. And then you want to make sure you're putting on a thin layer of maybe like an antibiotic ointment or some type of anti-acne medication in the evening. So depending on the skin type and how bad the acne is, you can do preventative or curative treatments. And you want to protect the skin from UV. Your ultraviolet light does exacerbate acne. So if your child is already prone to these breakouts, you want to make sure not only are they moisturizing, but they're putting protection on to protect them from the ultraviolet light. The other thing you want to do is if they do have an eczema flare, you want to control it right away. Eczema can be very irritating. It causes a lot of itchiness, burning in the skin, and also just irritation, regular irritation. So what you want to do is make sure your kids are treating the eczema right away by moisturizing, by using an anti-inflammatory like a low-dose steroid to treat these eczematous flares so that they don't worsen and cause more distress. I hope that was helpful. It looks like we have another question coming in. This is from Isaac. Hi, Dr. C. My toddler has very dry skin, and my wife and I don't really know what to do about it. We put cream on it, but his skin still cracks and bleeds. We would appreciate any help. Well, Isaac, that's a great question. So, there are some kids that have very dry skin and it's so hard to really hydrate the best you can and get through to them to get them on the other side with the nice, smooth skin. So what I would say is, first of all, in addition to your skincare routine, I would bathe your child twice a day with warm water. I would make sure you're bathing them with a soap such as Cetaphil or CeraVe that has ceramides that will actually hydrate their skin and restore the dermal bonds. Then you want to make sure you pat them dry after their bath so they're not too dry. You don't want to rub them dry with a towel. You just want to pat them dry and keep them their skin a little humid, and then moisturize with an ointment such as Aquaphor or Vaseline. And what you want to do is really put the CeraVe first to moisturize. Then you want to lock it in with the Aquaphor Vaseline so that you're creating this layer that's going to lock in the ceramides and the moisture. And then what you want to do is repeat that morning and night. And keep doing that every day. You will hydrate the skin and eventually get through that cracked period. And I have a professor that used to teach us many years ago, and I still use it here in my office, something called wet dry wraps. If you really have that cracked skin that's bleeding, what you can do, which is kind of an alternative method, it's unconventional, but it works, is you could, after the bath, do everything that I mentioned, but then you wrap those areas that were cracked and dry and bleeding with a thin gauze, and then you spray that gauze with warm water. You spray it with a spray bottle so that it's damp, and then you put dry pajamas over your baby so that those areas are wrapped with the gauze, and then you put a dry pajama over them, and you're basically locking in all of that water and moisture into their skin. And you do this every night for about a week, and you can actually restore those cracked, bleeding areas. See if you can try that at home, and let us know how that works. Okay, so it looks like we have another question coming in now, and this question is from our YouTube app. It's from Yoshi. Hi, Doc. When should we see a dermatologist instead of our pediatrician for our kids' acne? Well, in pediatrics, we are very familiar with acne, and we do treat acne in the office. There are so many different treatments, and it just depends on the severity of your child's acne. We have a lot of different creams and treatments that we can get through before it gets to the point where we need to send off to dermatology. Usually, like I mentioned earlier, we start with, topical antibiotics, topical antiretinoids. There are many different soaps and cleansers that work very well. We also prescribe oral antibiotics that could be very helpful for severe acne, for cystic acne. There is also a spironolactone, which is a diuretic, and that is widely used for acne. And so these are all treatments that we can use, and we can monitor 1 month, 2 months, up to 3 months at a time, usually. And if these treatment measures fail, then a lot of times we can step up the therapy and send you to dermatology, because dermatology has some experimental treatments. They have a lot of trials in their office that they can enroll you in, and actually maybe even some laser care, and we could really step up treatment. But in the beginning, there's a lot that we can do in pediatrics to help treat your child's acne. So I would certainly make sure you speak to your child's pediatrician before you go into dermatology. I hope that helps. It looks like we have another question coming in, and this is from YouTube. This is from Trey. Hi, doctor. We recently heard about the allergic triad, which is allergies, eczema, and asthma. I think that's exactly what we're dealing with in my family. Can you address this, please? Well, I'm sorry to hear that, Trey. That is very difficult. So the triad of allergies, eczema, and asthma is this. Usually, if you have a family member with a history of asthma, you're likely going to have another family member that has eczema or maybe allergies. As far as two parents, if one parent has allergies or severe allergies, then your child might have allergies as well, or asthma, or eczema, or even all three. So they just basically go together within a family. And what happens is, these are all the same type of responses. You have an inflammatory response, whether that's happening in the lungs because there's been an allergic trigger, there's been an environmental trigger, maybe a trigger such as like a viral illness, and that causes inflammation in the lungs, and bronchospasm, which is your wheezing. And this is asthma. And a lot of times you'll see these asthmatics are triggered by, let's say, environmental allergens. So they have some type of allergy, it causes dry skin, it causes eczema. So you'll see this happening usually in the same patient or within the same family. But a lot of times these things do go together. So if you have a child that tends to have breakouts and have eczema and dry skin, just be aware that they might also have asthma as well. So if they get sick and they're coughing more than your other child coughs, or they sound like they might be wheezing or have a different response to a cold than your other child, then you know that maybe this child has underlying asthma as well. So it's just to be on alert with those three diagnoses. So if there are any other questions, please send them in. I'm happy to answer them in real time. It looks like we have a question coming in from Percy. Hello, Dr. Constant. What are the biggest mistakes parents make when managing eczema? Well, that's an interesting question, Percy. I think one of the The most common things that I see, the most common theme I see here in my office is parents not really understanding how severe eczema can be and how important it is to treat it. I think people refer to eczema as just a rash and they downplay it. They don't find it to be terribly important. If the child doesn't seem to be in distress, they don't really treat it. Or they might just treat it for a day or two, and once they see that it gets better, then they abandon treatment and they don't really focus on preventative treatment. So rather than a big mistake, I'd say that one of the common trends I see with eczema is downplaying the diagnosis of eczema and not understanding how important preventative treatment really is. If you can keep your child's skin hydrated, if you can moisturize every day, keep that skin healthy, you can prevent eczema flare-ups from ever happening. Eczema is not a life sentence. You don't always have to have a flare. But if you don't take care of the skin and address it before it becomes a flare, then you will have these problems. I think also when the flares do happen, some parents don't understand how painful and how itchy and how miserable their child is, and they don't take it as seriously and they don't treat it as aggressively as we would like to. Physicians would really like to get at this the treatment with topical steroids. Some parents are uncomfortable with topical steroids. Just the word steroid puts them off, and they are not willing to treat their child with a steroid when really that is the mainstay therapy and it will help tremendously. And so a lot of times I find non-compliance in the office, and the non-compliance is because they're averse to the steroid, but also they don't understand how much their child truly is suffering. So I think it's important to note that eczema lesions, they do itch, they do tend to hurt and burn, and they do cause distress in your child. And the best thing to do is try to treat it as soon as possible. I think another thing that parents underestimate is the importance of hydrated skin. So even if your child doesn't have an eczema flare-up, dry skin alone is important to treat. Every child should be treated the same. Every child should have a soap that moisturizes, take a warm shower, and moisturize after their showers in the morning and night. They should moisturize every day, and then put on a moisturizer that has UV protection. And I think that a lot of parents believe that if their child doesn't have an active problem, then they don't need to moisturize. And that couldn't be further from the truth. All children need to moisturize. Dry skin is a problem. No one should have dry skin, because if you have dry skin, then you have very unhealthy skin. And with unhealthy skin, then you're opening up the door to other infections, molluscum contagiosum. You're opening up the door to impetigo. You're opening up the door to staph infections. So if you have unhealthy skin, which is a result of very dry skin, then you can develop other subsequent infections. I hope that helped. Okay, it looks like we have another question coming in. Lainey wants to know, hi, Dr. Constant. Do kids sometimes outgrow food allergies? I was allergic to shrimp and would get hives as a kid, but not anymore. Yes, Lainey, children do outgrow food allergies. That's why it is important for us to monitor the allergies, and we do retest in the office, and allergists also retest over time. So I would say probably anywhere from every 2 to 5 years to retest the allergies and just see where they are. Sometimes they outgrow them, and sometimes on the other end, the allergies get even worse. So it is important to monitor. It is important to constantly be followed by your pediatrician and or allergist. Well, that was a lot to cover. I hope that I was helpful. Please remember, take care of your child's skin. We need to hydrate, we need to moisturize, and we need to protect from UV. Please remember that allergies and allergy awareness is very important, not only for your child, but for all of the children around your child. It's important to be vigilant and to be aware of who is intolerant versus who is actually allergic. Thank you for watching, and have a great day.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.